Hello everyone, how are you today? I am very happy to be with you by a Dentium live surgery and follow-up. Next week, Lunar New Year is coming. I hope everyone watching this will be healthy and happy. In this Dentium live and follow-up session, we have prepared a special edition today. It names Ratings Award 2023. I'm going to review the first and second and third surgery videos and drew the most attention among last year. The second and third surgeries will be briefly reviewed by PPT, and the first live surgery will be reviewed by the video. And then looking at the prosthetic procedure and part. Okay, let's get started. As I mentioned before, the 2023 rating 3, the best 3 is as follows. Number 3, third prize was vertical augmentation, both of a maxillary ridge, posterior ridge. And number 2, the second prize was ridge augmentation also using the soft membranes and the GBR procedure. And finally, number 1 place, first prize, like a gold medal, was sinus elevation lateral approach by using DASC Simple Kit. Okay, number 3, the third ratings was overcoming severely defective ridge with staged process concept. Done by all the procedures, all the surgery was done by Dr. Chung, as you know. First, actually, maxillary GBR using mesh plate procedure is the key point. As you know, as you can see, the left panoramic view shown us about the ridge defect, the vertical ridge defect, and also horizontal ridge defect. The very big areas have a big defect situation. So 6 implant was placed already, the key area. So these 6 implants pictured supporting the temporary denture. However, the patient want to have a fixed dentition, fixed prosthesis, finally. So we need something to do. So Dr. Chung have decided about these areas, need more implant fixture, especially this right upper, the maxillary area, also the left upper maxillary area. The additional implantation with GBR procedure. However, as you know, this kind of big defect, especially vertical big defect, is very difficult to overcome. So we can see how can the overcoming this defective ridge. First, after flap reflection, as you know, a very soft bone was shown and very small bone volumes are remaining. So first, before starting the GBR procedure, first make the penetration, the decodification, cause of the helping the blood supply from the marrow space. At this time, using the taper Fisher bar was used. Actually, as you know, there are many devices to making the decodification, to helping the blood supply from the marrow space. First, small round bar was applied also, and also you can use the Rinderman drill, like a Rinderman drill, and like this high-speed taper Fisher bar also available. And after this procedure, the adaptation and the bending and adaptation and trimming of mesh plate for the outline, according to outline, in future outline of a ridge defect. the mesh plate trimming is very difficult procedure. However, very important procedure. Cause of according to this mesh shape and trimming shape and adaptation is the key of the success GBR procedure, like this big the defective area. And after that, the bone application, the bone graft materials application with the titanium mesh fixation. This titanium mesh fixation is first, and then the bone graft application is next. Why? Because of some of these titanium mesh from the Dentium company have enough the space, enough the perforated space acceptable the afterwards xenograft application. So this one is easier to apply the bone graft into the defective side. First, trimming and the scissoring, trimming, bending titanium mesh and adaptation, the defected area and fixation with the screw. And after that, through this mesh, through this perforated, the titanium mesh perforated space, we can put the graft materials into the defected area. So filled with the osteon xenograft first, like this one, and after that, osteon 3 collagen was applied, as you can see. Why this kind of layer technique was applied by Dr. Chung? Dr. Chung think about the effect and the advantages of different types of graft materials. First, xenograft. As you know, xenograft is a little bit better than the alloplastic materials for newly forming bone formation, right? So the osteon xeno is first applied for the inner layer, and after that, to maintain the volume, the newly forming bone volume and the defected areas volume maintenance applied by osteon 3 collagen. Osteon 3 collagen, as you know, very famous worldwide prevailed alloplastic collagen graft materials. So the outer layer filled with this osteon 3 collagen graft material. So we can maintain the volume, maintaining and the formative, the defected areas by using this osteon 3 collagen, the collagenated bone. And after that, collagen membrane was applied. Hold this, the grafted area. So a little bit big sheet of collagen membrane was applied for fully covered this GBR site. At this time, as you know, the collagen membrane 2 was applied. What is big difference between collagen membrane, the previous version, original version, and the collagen membrane 2? First, actually, a collagen membrane, the original version, is a little bit stiff and strong, and a little bit longer lasting than collagen membrane 2. The collagen membrane 2 have big advantages compared to another barrier membrane. First, have some resilient, and it is difficult to tear. So like a pin fixation technique or some sausage technique or modify different kind of sausage or some wrap around technique was applied easier with this application of collagen membrane 2. So more adaptable, more manageable, and the more resilient properties make us easier to hold these defected areas, the coverings. And the 1 month later, another part of maxillary area was the procedure done by Dr. Chung. Actually, the same manner, right? All these procedures are same compared to the previous one, the upper right maxillary area. First, make a small perforation, decodification, to helping the blood supply, and applying the titanium mesh plate, scissoring, cutting the plate, and the adaptation and the bending, all the procedures are same for the preferable situation of this defective area in future, the transforming, newly-forming bone. And after that, application of osteon xenograft. This one is from the bovine. This one is brand new graft materials of Dentium company. Actually, this xenograft helping more bone formative function. So the inner layer is filled with osteon xeno after fixation of mesh plate, and outer portion filled with osteon 3 collagen. As I mentioned before, this osteon 3 collagen, collagenated bone formed by the alloplastic materials, consist of alloplastic materials. So these alloplastic materials have advantages to maintain the bone volume, the volume maintenance situation. So after that, the collagen membrane 2 also applied this GBR the area. This big, the defective areas, GBR procedures was done by using this titanium mesh and double layer bone grafting application and suture. The suture is very important. All the surgeries starting with incision and all the surgeries finishing with suture. So this horizontal matrix sutures and the continuous sutures was applied for the intimate, the flap closure and the guaranteed flap closure during the healing status. So the healing status, the soft tissue covering is very important because of underneath bone grafting should be protected by these soft tissues during minimum 4 or 6 months cause of bone formation period, right? So it is nature. Okay, left, we can see the panoramic view after application, a GBR plate, the titanium mesh plate with the pin fixation, the after bone grafting. The actually upper right, the maxillary area, the maxillary areas have the bigger the vertical and horizontal defect here. The opposite side is a little bit better than the number 10th area. However, what is the result? Actually, it is very important and expected situation. Okay, so 6 months later, the first surgery with just bone grafting and the titanium mesh and waiting 6 months. Why? Actually 6 months is the minimum time point because of this big defective area. Defective areas need more time to make new bone formation, right? So just only 6 months. Actually, for me, this kind of situation, I need more waiting time. Actually, 6 months, over than 6 months, like 8 months, or sometimes we have to wait 10 months. However, just only 6 months waiting period, and we can see this secondary surgery, and we can see newly forming bone underneath titanium mesh area, right? So after removing the titanium mesh, and we can see the clear newly forming bone, new bone formation, right? So during the drilling or touching, this underneath newly forming bone gave us some information. This newly forming bone was good or not, cause of some hardness or some tactile sense. But also we can see more harmonized with the host bone. That is important part. This side, the bone quality, So you can see this area. I think these areas, I think a much better, good the result after the GBR procedures, newly forming bone. And during the drilling and implant fixture insertion status, we can feel again this new bone was good or not, because some of bone is so softer and the breakdown and the gone away, and the bone that's still there. So that kind of things is very key, is important key point. Decide this bone is working or not in future. But anyway, this bright implant fixture was installed, diameter 4.0, 7 millimeter, right? The bright, a brand new system of Dentium company, the bone level implant fixture system. And also 4.0, 9 millimeter, another one. And after flap closure, the PDRN applied for the promoting soft tissue healing and more the bone maturation. Okay, and the opposite part is same as a previous one. Make an incision, flap reflection, and remove the titanium mesh plate, and starting with the initial drill, and finally implant fixtures placed. Actually, ordinary this kind of a situation, I always tried undersized drilling, as you know. So I think you guys also have undersized drilling cause of maximize initial stability, maximize the stability of fixture. And the two implant installed this GBR site. First one 4.09 millimeter, another one 4.07 millimeter. Two of the bright implant system was installed, and a little bit more the auxiliary, the secondary GBR procedures was done. Proceed using Austin 3 collagen. This Austin 3 collagen also the versatile the graft materials when we have this kind of secondary or the auxiliary minor the GBR procedure, the without membrane. Okay, after the cone beam, after surgery, we took a cone beam CT like this, number 15, number 13, number 24, number 25. All of these fixtures are installed very nice and good situation of the newly forming bone, right? So I think very nice, the axis and the homogeneous newly forming bone also was seen. Can you see like this one? Yeah. Have some a little bit sinus elevation was simultaneously applied, and this one is just only installed in the picture into the bone, newly forming bone, and this one is also the same. New forming bone, the whole this part of implant fixture. And another one, 25, a little bit the sinus elevation, like the crestal approach, and installed same manner. And hold these implant fixtures connect with the healing abutment. Actually, this healing abutment working a dual function. First one, the scan abutment. Another one, the healing abutment. Okay, and after the healing status, we can see very nice, beautiful, the implant installed, connected with a healing abutment, the scan abutment. 1, 2, 3, 4, 5, 6, 7, 8, 9 implant installed already, right? Hold this implant can be used by fixed prosthesis as the patient wants. Okay, this one is provisional lustration. What do you think about this kind of style of the temporary prosthesis? Some doctors want to have some make a gum or the base for the achieving, the enhancing the aesthetic situation. However, in the site of the cringing, the patient cringing and the patient the management, they actually a little bit make a wider interdental space, and this kind of just even though the long crown, this temporalization is better to maintain by patient. Actually, as you know, according to ITI consensus, the compared implant fixture to the upper, the superstructure portion is about acceptable 1 to 2, right? The ratio is 1 and 2. However, these prosthetics may be over 1 to 2. I think the ratio is the more than 1 to 2. However, all these fixtures combined connect each other, right? With one or one piece available. If possible, one piece is okay. However, we can make a the partition, make a 3 section for the whole arch. But anyway, some of the fixtures connecting each other, so helping each other also. This one is final illustration, as you know. So that is big difference. Actually, the conventional style have make a gum portion, like a denture base portion. So hybrid type to enhancement of aesthetic outcome. However, Dr. Chung have decided the cleansing and maintenance, the management of the patient is better than aesthetic. Especially this kind of elder person is very difficult to toothbrushing or some cleansing the area, right? So Dr. Chung give this kind of prosthesis to the patient, the management. So I think this one is one of the options for the final prosthesis. Okay. I think in the aspect of long-term follow-up, even though the little bit the lower aesthetic outcome, however, the maintenance is better than like denture-based style, hybrid style, the prosthesis. Okay, so final illustration and the final cone-beam CT view. I think bone, the surrounding the implant fixture is denser than before. So that is clear. The key point of the bone quality is better and better than before, right? I think even though the bigger the ratio, implant fixture and crown ratio is bigger than 1 to 2, however, all the implant fixtures still stable survival cause of the final prosthesis make the working, make the connecting each of the fixtures make one pieces. Okay. Okay. This one was third place prize, the cases. And next, let's move on the second ratings. Second ratings case very similar to the previous one. However, the previous one caused the vertical defect area, so using the titanium mesh. This case actually using just the collagen membrane with the collagenated bone on upper anterior area. So narrow implantation and ridge augmentation on defect area on upper anterior side and lower posterior also. Okay, so as you can see, number 22, 23, 24 is missing. So the horizontally reduced area, I think it is not available to the proper positioning implantation. And the lower, the posterior area, also the reduced ridge width. However, normally, as you know, in general speaking, the lower area is not so a little bit better than the maxillary cause of even though the smaller ridge like this looks like a smaller narrow ridge, after flap incision and after flap open, we can see a little bit wider cause of the cortical bone plate is stronger than the maxillary side. So the lower jaw, the mandibular posterior is better situation compared to the maxillary in general speaking. Okay, so before the starting the surgery, we imagine the incision line. After the surgery, we have a suture. We will have a suture. So before starting the surgery, we have to make an incision line. So the proper incision line is the starting point of the surgery. Good surgery is starting with the proper incision line. Anyway, the crestal incision and the clavicular incision, sometimes we're going to make a vertical incision, the proper position, right? So it is very important to a factor cause of, for the successful GBR outcome. After incision, flap reflection, we're going to see like this very big defect, number 22 and 23 area. So only 24 areas acceptable for implant installation at the same time. So Dr. Chung is starting to Lindemann for the proper positioning and the starting osteotomy, and implant fixtures installed the bright TL. TL means tissue level, right? So bright system have two different line. First one is bone level, as I mentioned before, and another one is tissue level. So this tissue level was installed diameter 3.0 and 11 millimeter. The smaller, however longer picture was installed. Cause of the narrow reach 3.0 was selected. The key is here. Anyway, whole the implant fixtures surface should be covered by host bone that is best condition, right? Even though the smaller diameter. So you have to choose a little bit smaller diameter, but stronger. These pictures should be surrounded by host bone. That is a best choice when you have a GBR procedure with a defected area, right? And after that, using these fixtures, we're going to make this the healing abutment and connect with the collagen membrane like this one. Also this time the collagen membrane tool was applied for the better situation. And another one side, the pin fixations for the fixation of the collagen membrane, right? So that is up to you. Depend on you, your style, the collagen membrane 1, the original version, or collagen membrane 2, depending on you. I prefer to use collagen membrane 1 cause of have some rigidity. However, this time, using the membrane pin and the more adaptable situation is the more considerable factor to choosing the membrane. So Dr. Chung chose this the collagen membrane 2 more flexible and the elastic give us elastic the properties membrane. So finally Dr. Chung chose this collagen membrane 2 for fixation, and membrane pin was applied and applied with osteogen xenograft for the covering, the filling the defected areas. As you know, as you can see, this very big defect vertically and also the horizontally. So osteogen xeno inside and moving to the lower part, actually the closing the flap and moving to lower part, 36, 37 areas. As I mentioned before, can you see this ridge width? Ridge width is here. Before flap open, so narrow style, looks like a narrow ridge. However, after incision and flap reflection, we can see a little bit wider than we expected. So we make a little bit wider implant fixture can be installed can install cause of this reason, right? The bright TL was installed 4.0, 9 millimeter. And the anterior portion, number 36 areas installed with a bone level implant, 4.09 millimeter, right? So can you see the same diameter, same length, however, different system. One is a bone level, another one is tissue level. So it is very interesting viewpoint comparing each other after the final prosthesis, right? Let's see. So installation and the bone grafting application with the osteon xenograft also. So the collagen membrane too applied and the suture. This one is actually, left one is after surgery view, number 24 areas, upper maxillary area, anterior, and the right side, the intraoral photo showing us about 36 and 37 area. A very similar view. However, the left one is upper, the right one is lower. I think the right one, the lower portion is better to have a GBR procedure to make simplified. Anyway, this one is during healing status. Number 24 areas, they're still there. However, some of anterior portion, number 22, 23 areas, a little bit exposed during the healing processes. However, the collagen membrane, the nature, the property is better than the actually good, the healing potential and the good integrity to the soft tissue. So during the healing status, even though like this a little bit open situation, automatically the closing by soft tissues like epithelial cells and the connective cells, they're coming together and all these defective areas they're covered by soft tissues. Why? Nature of membrane properties, right? So tissue friendly, tissue integrity is very higher than any other the barrier membrane. So the lower part is very similar. So that is important things. Even though the flap closure or the incision design or flap reflection and closure procedures are a little bit the shortage or some of little bit the lower quality after the suturing. However, covering these the materials cover us our little bit small the mistake, right? Small shortage of our skill. Anyway, this collagen membrane covering us during the healing status. Anyway, very nice. The well done final situation, even though the little bit the sloping situation, don't worry about it. Actually, this area means not fail, right? This one is nature procedure, the normal procedure during healing status. And after that, as you know, after the final healing, very nice, well done, soft tissues cover this GBL area, right? So also 6 months later, Dr. Chung have a second stage surgery. So flap open and removing the pin, and we can see the new forming bone underneath the area. However, the vertically a little bit the shortage. However, the horizontally, I think enough, the bone formation was achieved. And number 23 areas was the surgery was done by additional surgery cause of another one more implant fixture installed. Bright TL tissue level 3.0 11 millimeter, same as previous one. So and the skip number 22 area cause of these areas will be covered by the cantilever final the prosthetic bridge. So strategically, Dr. Chung chose number 23 and number 24 area for implant fixation. Collagen graft 2 is applied. This material is very interesting, also very tricky. Actually, as you know, the collagen graft is a little bit the different nature, different properties compared to the barrier membrane of collagen, right? So this collagen graft sometimes actually getting better, give us a better result compared to the barrier membrane. Why? Barrier membranes basically have some occluding effect, the barrier effect. So the blocking the blood supply, sometimes a little bit a thin biotype or the peaceable soft tissue type. Actually, the cutting the blood supply means the shortage of soft tissues, and the open or some of soft tissues gone away. So the situations, the actually getting worse. However, this collagen graft hold this blood and hold all the regeneration, the factor, right, the growth factor, right? So the working as a barrier function and also holding this blood and some of the promoting the effective that was given. So I think sometimes I prefer to use collagen graft 2 also, right? Instead of collagen membrane. Cause of this collagen graft 2 is much better, much friendly to soft tissues, and the better healing of soft tissues, and the better performance to get the final result, this kind of little bit the tight situation. So collagen graft 2 was applied sometimes with soaking with a PDRN, some doctors the soaking with some another the growth factors or just blood or some another the PRF. It doesn't matter. It depends on your style that you can do like this. There are many different recipes to get the better result. So for me, actually, I prefer to soaking with the PDRN, and also Dr. Chung have a same manner. However, some other doctors want to have a soaking with PRF solution, PRF, or some another solution like a growth factor. Doesn't matter. Actually, the key is the cost. And the scan comfort cap connection. And after 2 weeks, the healing status, healing situation was good. And the 23, 24 areas covered with the cantilever, the PMMA temporary bridge, and the lower part, 36 and 37 also, the made by PMMA temporary crown with abutment. Okay, so this one is final prosthesis. Actually, between number 21, 22, and 23, between the lateral incisor and canine have a little bit big defect of the soft tissues, interdental papilla is loss of interdental papilla, so the lower the aesthetic situation. However, I think these spaces filled with soft tissues in future, a little bit more and more. And what about the number 36 and 37? I think the crown length is different, right? So can you remember before starting this the case, I told you about this the very interesting situation, a very similar situation. However, the bone level and tissue level gave us sometimes gave us a little bit different outcome, especially in prosthetic aspect. Here and here. The emergence profile was different. Okay, so why? Cause of the installation, depth of implant installation. The previous one, 36 areas bone level implant, little bit deep insertion was achieved. However, number 37 area, cause of the bone height is better compared to number 36 area. However, the tissue level fixtures should be lower installation. However, anyway, the final outcome is acceptable. However, I mentioned about the focus on the emergence profile and crown length compared to neighbors of the tissues. So that is very interesting point compared to bone level and each of the tissue level and bone level compared to each other is very interesting factor. So actually when you choose a tissue level implant fixture, you have to consider the gingival cup, right? So top portion of thread until the underneath of this gingival cup, this distance is very important. This bright tissue level have only one gingival cup, 1.5. So you have to keep in mind when you have tissue level implant fixation, your patient, right? 1.5. Simplified, simple, better. However, sometimes you have to consider the final lastration. The almost case can be overcome because of the customized implant, customized abutment was applied. However, sometimes we have to consider the gingival level and the bone level like this one. And actually, last one, finally, we come to first reading last case, final case. So this case is actually incredible case, incredible. Cause of remaining bone was almost 1 millimeter. 1 millimeter, very small, tiny bone remained, and also quality is so soft. So how can we deal with this kind of situation of sinus? Actually, staged approach is the answer, right? The doctors want to have a staged approach for this kind of situation of maxillary sinus. However, Dr. Chung have applied some the incredible approach using brand new devices. That's simple. So let's see. Before the surgery, we can see this area, especially this sinus. Can you see this area? The floor of the sinus downward, converging downward. So that is first problem. And number two, between the natural tooth and tooth, between the natural teeth and the middle portion will be implant. So that is number two, the difficulties. Anyway, after removing the bridge work, and Dr. Chung have decided this area is overcoming by a brand new kit, that's simple, and also the brand new technique. So let's see. Implantation on number 15 will be will be planned by a bright bone level. Actually, these areas, bone level also applied. However, just only 1 millimeter. So a little bit more and more tightening gave us a risky situation. These fixtures suddenly falling into the sinus cavities. So preventing this situation, some doctors want to use this tissue level implant. Cause of tissue level implant have a neck portion, so automatically stop and tugging the sinus floor. So suddenly falling down into the sinus cavities, preventing the falling down into the sinus cavities accident. However, Dr. Chung trying with bone level, even though the 1 millimeter, very small bone volume and softer bone case. And the bone graft was osteon-3 collagen, right? The collagenated bone. So at this surgery, Dr. Chung showing us about the brand new kit, simple, the Desk Simple. Desk original version also available. However, these tiny areas, Desk Simple is better because of the small head of lateral drill, the matchstick type lateral drill. Can you see? This lateral drill is only 4 millimeter, smaller than the original version. You know, the original version, the yellow head, the half sphere type head, two different diameter. Smaller one 6 millimeter, bigger one 8 millimeter. However, this Desk Simple have a smaller than that guys. This black small head, the matchstick type, so the more sphere shape and just only 4 millimeter. So optimizing for this tiny the window making, right? And also the osteon 3 collagen was introduced for the better to optimize the proper bone grafting materials for sinus cavities. Actually, these collagenated bones already proven to acceptable as bone grafting materials for sinus surgery, right? There are lots of the research papers that proven this collagenated bone also gave us a good result. When you have a lateral approach, crestal approach, it doesn't matter. The same manner, right? And the bright bone level, as I mentioned before, these bone level implant fixtures have a unique connection, 10-degree, 3.7 millimeter deep connection. Actually, all of internal connections are similar resemble to Astra connection, 11 degree. However, this bright bone level have a 10 degree, smaller than 1 degrees each side. So totally 2 degrees is smaller, more steep. That means give us a bigger, the stronger connection and the rigidity between implant fixture and the abutment. So that is important factor. That is key using this bright bone level. The afterward, connecting with the healing abutment. Afterward, actually the abutment connection with the fixture more stronger than the Astra connection style. So excellent joint stability and no screw loosening or no sinking down phenomenon. Okay, let's move to the surgery video. Okay, so the combine each other, the previous information, explanation by me and this video combine each other, and you are able to learn about this minimized concept, the sinus surgery. You know, actually these situations, the ordinary crestal approach is better. Why? Between two natural teeth, the smaller tight space, it is very difficult to make a lateral window, right? Because of root of natural neighbor natural teeth. However, the remaining bone was 1 millimeter, right? So that is a difficulty, the problem if we want to have a crestal approach. So the decision was lateral window. However, just the tight space, because of tight space, Dr. Chung get the semi-lunar incision, circle down, circle around the semi-lunar style incision, and the minimized flap reflection. The first Lindemann drill was used as a marking drill, even though the Dr. Chung doesn't want the flap reflection in the crestal area, so just marking like the soft tissue punch, and after that using this small diameter head, the matchstick head style, the lateral drill was applied for making lateral window, 4 millimeter, smaller diameter, achieving this smaller lateral window. And after that, we're going to see grayish color. It means the lateral wall was grind out almost. So checking between the drill between drill and drill, right? So drill first and checking, and the next drill and checking. That is proper procedure for using this desk kit. And the grayish color is bigger, and applied this small dome-shaped sinus curette was applied, and the tugging circle around the motion. This motion separates the sinus membrane from the lateral window, lateral wall of the sinus. So the secondary grinding out for the enlargement of lateral window, even if the drill had directly contact to the sinus membrane have some resilience cause of already separate using this dome-shaped smaller sinus curette. So have some fluctuation even though the pushing direct from the matchstick style, this black lateral drill. And the membrane have some room to give us some room. So direct touching, even though direct touching, no tearing, no scratching anymore. So we can use this sinus curette as well. So the procedure and the whole procedures are very simple. And after making the space between into the sinus cavity and pushing this graft material's collagenated bone, the osteotomy collagen is optimized to make sinus elevation. Actually, I prefer to use this kind of graft materials, collagenated bone, instead of particulated bone. This one is better. Why? Time saving and not scattering each other, and also holding the graft materials into the sinus cavities, just pushing into the sinus cavity, and that's it. Cause of the collagen holding materials, collagen binders, holding all the graft materials, particle materials, holding, and just stay there into the sinus cavity, in the sinus cavity. So don't worry about it anymore. And make a small pieces. The actually osteotomy collagen have the cylinder, the pellet type. So after saline soaking, we're going to cut, make a smaller pieces, and then put it again into the sinus cavity, the pushing into the sinus cavities. Make feeling some of resistance from inside of the sinus cavity. It means all the made spaces after using the desk kit filled with graft material. That means filling with the graft materials. What? Some of resistance from the inside of the sinus, right? When you use these graft materials pushing into the sinus cavity. Okay, so all the desk kit starting with the elephant foot and finishing with long bow. We have 4 different shapes of sinus curette for detaching the sinus membrane from the lateral wall and the sinus floor, and depending on the angulation and the accessibility, you can choose the different shape of sinus curette. Anyway, after using whole this sinus curette, you want to make some empty space between membrane and floor, and bone grafting materials. Yeah. pushing, go through all the way down there, and after that, the osteotomy and the installation. Just only 1 millimeter. That is all that we have. So that is big problem, right? So sometimes you're gonna go like a staged approach, waiting 4 or 5 months later. We can do just simple osteotomy and implant installation. That is good choice also. However, like this Dr. Jung's style, the minimize concept with implantation also. Yeah, this drill, this final drill, Lindemann style, the final drill, a little bit different shape of the original version. The underside drilling was essential. And I think a 7 millimeter and 4.0 diameter was installed, right? A very delicate situation, very delicate procedure. So I think we need more experience when we have this kind of situation, if we want to have the same result of Dr. Chung. I'm not sure the fixation, the initial fixation status. However, I think Dr. Chung is going to connect with the healing abutment, even though the bone volume, right? Yeah, the healing abutment. The height is so low, so he is going to change. He is going to change the longer one, healing abutment. Actually working as a scan abutment also. We can see the notch of this healing abutment. So this notch working as a scanning, working for the scanning. However, the initial stability is so low, just a small height of healing abutment is connected. And checking, the easy check, this device is showing us about how much initial stability, right? The same as ostial mantle. However, ostial mantle need the pack, but this one is doesn't have any pack or doesn't have any devices. Just tapping on the healing abutment, or just tapping, or some another the head. Just tapping is enough to get the score, right? So you don't need changing the healing abutment to this scoring pack like ostial mantle. It's just only one sutures, no membrane covering over lateral window, right? Can you see? Did you see this? No membrane, just only one suture, and another pin fixation was applied. Very interesting. Very interesting. Okay. One tap, and using the scalpel and removing this bone tag safely. Additional tapping. Wow, so fast, even though the extreme case. So faster finishing. Yeah. Dr. Chung achieved very nice, well done result of sinus elevation with simultaneously implantation, even though the remaining bone was 1 millimeter. Okay, thank you for watching. We will have a 10 minutes break and I will be here again and the next session will be started. Thank you. Welcome back, everyone. Let's see the post-op panoramic view and Convim CT. As you know, as you can see, the left side panoramic view shown us very nice, well done bone grafting with implant installation. Even though the smaller diameter and the shorter length, however, Dr. Chung get the higher insertion torque, so connect with the healing abutment, dual function abutment, like this one. So what about this right side Convim CT? And the very nice, well done bone packing into sinus cavity using osteotomy collagen, as I informed to you. So this osteotomy collagen have big advantages like this one. Just make a small pieces and put into the sinus cavities a little bit more and more. And this collagen, osteotomy collagens by itself moving to the pushing to the sinus membrane inward of the sinus cavity. So holding the pieces, holding bigger and bigger, and all these osteotomy collagen graft materials achieving the bone grafting spaces into the sinus cavity. You know, the maxillary sinus have a good, very extremely good the circumstances to making a new bone. The very nice, good circumstances achieving new bone formation. So these osteotomy collagen as a collagenated bone graft materials working as very nicely new bone formation. So I strongly suggest to you this osteotomy collagen as a bone graft material. So when you use sinus surgery, lateral, crestal, both of them, the procedures available using this osteotomy collagen. Okay, the post-op intraoral view, healing 1 week. Cause of the small minimized semi-lunar style incision, the circle around the incision, and the flapless installation procedure. So the soft tissue healing was faster, just only 1 week. All the situation looks like a normal. So that is already to get the scanning, right? So intraoral scan for final processes using intraoral scanner, and CAD for final processes. After this CAD program, CAD design, we're going to make the zirconia crown and zirconia bridge for the natural teeth and the implant. So this yellow arrow indicated implant crown. Oh, sorry. Once again. So we can see the final illustration, this one. So I want to mention about this final illustration. Cause of the gingival line. What do you think about the gingival line? The unbalanced, right? So however, it is some of limitation, cause of inward inversion of sinus cavity, right? Sinus cavity is downward, and the remaining bone was 1 millimeter. So let's see, normal situation, actually the overcoming, getting better aesthetic gingival line, we're going to do a little bit deep insertion of implant fixation. When we have an implant fixation, we're going to do a little bit deep insertion. However, this case, it is impossible to get the deep insertion cause of sinus inward inverging, and the remaining bone was so small. So that is limitation cause of this patient, right? And another one is have some little bit reduced, have some buccal depression. So these buccal depressions can be overcome using Austin 3 collagen a little bit more. When you have a second stage surgery or a little bit more minor small incision and put the graft material into underneath soft tissues, also making a little bit the higher bone, higher the volume augmentation will be achieved by using Austin 3 collagen. And number three, the solution, the last solution chance was custom abutment. Custom abutment, a little bit downward, the subgingival, and a little bit wider, and we can make a little bit more, the better, the balance, the gingival line, the crown, the ordinary, generally speaking, the ordinary situation. I think, however, this outcome also very nice and well done, because of even though the smaller bone volume is very tricky and very at this tight, the remaining bone situation, the using small semilunar implant, and that's it. So simple. It was so simple procedure. Okay, the first follow-up, the panoramic view after inserting the final processes with the zirconia crown with the custom abutment. I think the very shown to you about this simple procedure. Okay, here is the question. The first one is what is Austin 3 collagen advantages when you have a sinus elevation? So all the information already given to you during the explanation about the surgery, right? First, the time saving. Is it too grafting and holding itself into the sinus cavities? And let's see, the crystal approach also same. After making the osteotomy hole and for me make a smaller pieces, Austin 3 collagen after soaking of the saline and then make a smaller pieces and small pieces pushing into the osteotomy site and the pushing into the sinus cavities a little bit more and more one by one, and these Austin 3 collagens by itself pushing the sinus membrane inward, upward, right? So the like hydraulic procedure, so automatically, safely elevate of sinus membrane and simply grafting also achieved. Okay, number two question, do you have any tips for using desk simple when you have sinus elevation? Also, all the information is already given to you. Desk simple is unique. Actually, we couldn't see the crystal drill today. I think after next time, I will get the chance to introduce about crystal drill. This crystal drill is so unique and safe and faster applying to the crystal approach. The first one, the unique device is crystal drill for crystal approach, right? The spreader drill, the crystal drill, expander drill, the naming is a little bit different, but the device is the same. The crystal drill is a unique one compared to original desk version and desk original version. And number two, the smaller head lateral drill, right? So this one is a big unique situation. And also the desk simple usage tip is to make a smaller, we can make a smaller lateral window. So, and another big advantage is the head of lateral drill have more the contact surfaces compared to the original version. Original version have a half sphere shape. So just only 180 degrees angled the contact surface. However, this one is almost sphere shape. So much better contact surface was achieved. So it means higher efficiency to grinding out the lateral wall of the sinus, right? So the angulation is better, and the time saving and effectiveness, and almost the smaller diameter, smaller lateral windows achieved. And then if you want a little bit wider, the bigger lateral window, you're going to do after separating the sinus membrane first, and then the second grinding drill is applied. So after that, when you use the secondary applying the lateral drill, you have to use the lateral drills like upward, like almost 90 degrees, almost done. Cause of this one is reduce the contact surface, makes them safer than the smaller the contact smaller, make smaller contact surface. By using this lateral drill, the upright, 90 degrees, applied to lateral wall. That it is the one of the tip using when you use lateral drill, the black small head. Okay. Thank you for watching all this special edition session. And we will have a next surgery February 16th, same time, 7 p.m. Thank you for watching today. Xin cảm ơn. Thank you.